This is Dr. Jay at Function First Chiropractic and Rehabilitation. Today I'm going to demonstrate the bird dog for you. This is an exercise. It probably has a different name in the yoga community. I've heard it called different things, and you'll hear a couple different variations on prescriptions. So I'm just going to show you my own personal flavor, the one that I like to do, like to recommend to patients. So a very important step when you're doing this exercise is the abdominal brace. The abdominal brace is very different from the abdominal hollow. The hollow is just basically sucking in your stomach. That's not what you want to do here. You want an abdominal brace here, which is basically tightening all these muscles in the abs and in the obliques and the surrounding musculature, just kind of activating all those core muscles. So you're going to start out abdominal brace, back in a very neutral position. You don't want to have it overflexed or overextended, just real neutral. Abdominal brace. First leg back and down. Second leg back and down. And you're bracing the whole time you do this. Now if you can do that without any kind of pain or any kind of trouble, you can move on to the next phase. But you want to make sure that you can do that pain-free before you move on to the next phase. So the second phase, abdominal brace, and you're going to go right leg behind you, left arm in front of you. Left leg behind you, right arm in front of you. And you got to remember, you're bracing this whole time, and what you don't want to see is a lot of rotation. You don't want to be twisting and trying to get up as high as you can. That's just not, it's not going to do you any good. So you want to just tighten, abdominal brace, straight back, and down. And another good way to think about this is you want to pretend that you've got a glass of water sitting on just the small of your back there. And you can't spill it. So if you rotate too much, do too much of that, you're going to spill that water on the back there, and you're not going to get the full benefits of the exercise. So again, abdominal brace, leg behind, arm in front. And sometimes you'll get confused and you'll try and do the same arm and the same leg, and if you try and do that, you'll just pretty much fall over. So you'll know that you're doing the wrong way then. Now the last little tweak to this is I like to add in a little bit of cervical extension when we're doing this one. So we'll start out, leg back, arm forward, and I just tell the patients to follow the hand. And you're holding that top position for about 3 to 5 seconds. And you can do about 15 on each side. That's usually what I recommend to people. You can do it periodically throughout the day. Try and do it once in the morning, once in the evening. Just do it to tolerance. You don't want to over push it, but it's a real basic exercise. It's really good for getting just some activation in those core muscles, the glutes, the abs, just for getting things moving again. So that's the bird dog.